Have you ever heard of meningococcal disease? It's a rare bacterial disease that's on the rise again. This perilous illness caused by the bacteria Neisseria meningitis can lead to two serious conditions: meningitis, an inflammation of the protective membranes surrounding the brain and spinal cord, and a bloodstream infection, both of which can be fatal. The Centers for Disease Control and Prevention have issued a warning about this disease, reporting an increase in cases, with 422 reported just last year. This is the highest number since 2014. Interestingly, this disease seems to disproportionately affect adults aged 30 to 60, Black individuals and those with HIV, though it can strike anyone. Symptoms of meningococcal disease include fever, headache, and neck stiffness. If left untreated, it can lead to more severe complications and even death. Meningococcal disease is not as common as the flu, but its consequences can be much more severe. So let's delve deeper into this topic and arm ourselves with knowledge, shall we? So, you might be thinking, how would I know if I have meningococcal disease? What are the symptoms? Well, let's dive into that. The symptoms of meningococcal disease can be quite similar to those of a severe flu or a really bad headache. They include fever, severe headaches, and stiffness in the neck. Now, these symptoms might seem common, but they can escalate quickly, making the disease potentially fatal. As for how it spreads, meningococcal disease is transmitted through respiratory and throat secretions. Think about sharing a drink with someone, or being in close contact with a person who is infected. That's how the bacteria travel. However, it's important to note that this disease is not as contagious as the common cold or flu, so there's no need to panic, but there is a need to be aware and cautious. Remember, early detection and treatment are key to recovery, so if you have these symptoms, consult a healthcare professional immediately. Now that we know what meningococcal disease is and how it spreads, how can we protect ourselves? Well, the answer lies in prevention, and the most effective method of prevention is vaccination. Vaccines work by training our immune system to recognize and combat pathogens. When we get vaccinated against a disease like meningococcal disease, our bodies build up a defense system, ready to fight off the bacteria if we ever come into contact with it. Vaccines for meningococcal disease are recommended for children entering middle school, with a booster dose given at age 16. This is a crucial age bracket as the immune system is still developing and can benefit greatly from the protection offered by the vaccine. It's equally important for people at higher risk to get vaccinated. This includes those living in outbreak areas, individuals with certain health conditions, and specific demographics that have been identified as disproportionately affected by this disease. These vaccines are not just about protecting ourselves, they're about protecting our communities, our loved ones, and those most vulnerable. So, what can we take away from this? In the fight against meningococcal disease, prevention is our best weapon. Make sure you and your loved ones are vaccinated. The rise in meningococcal disease is a serious concern, but together we can make a difference. It's crucial that we all play our part. Inform your friends, your family, your community about this disease. Recognize the symptoms: fever, headache, and neck stiffness. Don't ignore them, and don't let others ignore them either. Prevention is better than cure, and in this case, prevention is a vaccination. Ensure you, and those you care about, are protected. Remember, this disease doesn't discriminate. It can affect anyone at any age. Don't wait. Protect yourself and your loved ones from meningococcal disease. Get vaccinated today.